Great. Thank you, Maureen and Lindsay. It's my pleasure to present the state of medical education, and alumni welcome and thank you so much for all you do to support the medical school. This is my starting my ninth year as Vice Dean for Education and Academic Affairs, and I've tried to do these every year, and it was pretty clear to me that the most valuable part of this presentation isn't anything I'm going to say, but it's the interaction with the students. So thank you, students, for joining us, and we'll introduce you and get to you in just a few minutes. I have no real conflicts other than I'm still a practicing nephrologist, and I think that the kidney is by far the coolest organ in the body. So medical education in the medical school is an office of medical education that includes admissions to medical school, the 4 years of medical school or undergraduate medical education. And we have about 1,000 medical students across both the Duluth and Twin Cities campus, graduate medical education, and we have about 1,000 residents and fellows in almost 150 different programs, and continuous professional development, sort of the old CME, which puts on programs for both our faculty, but also for the community. And there's a few other aspects of it, including a medical education outcome center, which I'll talk about briefly. We have an undergraduate degree in mortuary science in the medical school, the only medical school in the country that has that, as well as a fairly large anatomy bequest program that deals with body donors or requests for donors for other schools or industry. And so that's our Office of Medical Education that I oversee. We're proud of what we're able to accomplish. We're first in the nation for producing family physicians, fourth for producing rural physicians, 10th in the nation for producing primary care physicians. And when we've looked at practicing physicians in greater Minnesota, about 37% has trained at the medical school. And if we looked at all actively practicing physicians in the state, 70% either went to medical school at the University of Minnesota, did a GME program at the University of Minnesota, or both. So we have huge potential to impact the future physician workforce of the state and consequently the health of Minnesotans. This is just a brief overview of the 4 years of medical school, bracketed by orientation on the left-hand side and commencement on the right-hand side. And you'll hear from the students, they're from some of these different years. Even though the beginning of medical school tends to be more of the foundational science, more and more we've been trying to integrate clinical aspects of training to become a doctor into medical school, with year 3 and 4 being almost predominantly clinical. And this is a time where our 4th year students, it's actually tomorrow that applications open up for residencies, and they're starting to do interviews to get ready for match day, which happens in March. So a very abbreviated look at 4 years of medical school. So let me touch on a few national facts, and this was a workforce study done by the Association of American Medical Colleges. It came out in June, and it's looking at projected workforce changes by 2033. And you can see that there's a projected shortage not only of primary care providers, but also of other specialties, including the surgical specialties, medical specialties and other specialties such as pathology, radiology, and psychiatry. So it's a good time to get into medical school. The job market is great, and it's interesting. This year we've seen a huge jump in the number of applications to medical school. Up here by about 30%, nationally about 16% increase. And we can talk maybe and speculate why that may be. Alumni provide great support in terms of tuition and scholarships, and I wanted to just update the data. So this is where the University of Minnesota ranks among all public medical schools. And if you focus just on that middle column, we used to be, back when I first started, the fourth most expensive public medical school. In this period that's colored in, tuition has been held stable without an increase, and then just a small increase in the last 2 years. And we're now, this past year, 39th out of 90 public medical schools. And, on the right-hand column is for non-residents, and we're 65th out of 85th. So it's gotten better, and we're glad we're not in the top 10 of expense, but expense is still a real issue for our students. And I'm going to have you focus on this very last line. So this is our graduates in 2020. About 84% of them graduated with debt. The average medical school debt is $180,000, and the mean education debt, because many brought education debt with them from undergraduate, is $192,000. The other important numbers, this is all students, but if we looked at just those students who had debt, the average debt is over $200,000 from medical school, and $215,000 for all education debt. And you can look at the trends over time. So our students, tuition is still a major issue, and debt is still a major issue. That's my sort of not so subtle plug that any help with scholarships is very beneficial for our students. One of the things we established a few years ago was a medical education outcomes center, which is really a place to keep education data and to use that data to make decisions. But even more than that, it's how do we know we're doing a good job in medical education? What we're trying to do with the outcomes center is link education outcomes with clinical outcomes of our graduates once they leave medical school. And the Medical Education Outcomes Center is this place for data and to be able to use data to eventually, look at the outcomes, whether it's where students go to practice, where do they go for residency, and what kind of care do they provide. And this is a very unique resource at our school. 2020 has been a crazy year, and we've had three big things happen. First is our big accreditation visit happened this year. Then COVID hit us in March, and then all of the social unrest and injustice and racism. That was really, we've been the epicenter of that with the killing of George Floyd. So let me just take you through a couple of these. Our accreditation body is called the LCME, and the last accreditation visit was 2012. We got full 8-year accreditation, but our year 1 and 2 are learning both virtually with some in-person activities, including anatomy and physical exam. This is a really unique year for applications because there was national decision not to allow away rotations for our students, and not to do in-person interviewing for either medical school or residency application. And so, we're in the midst of a virtual interview season for both medical school and residency. The students have to take national exams, the USMLE exams, and testing centers closed down or were, canceled tests in a very, sudden nature. And so as part of the solution to this, we were one of 29 schools across the country that became testing centers for these national board exams, and that went really well. And then continuing medical education, which is also part of the medical school. If you can imagine a model where in-person conferences could no longer happen, had to transform as well. The racial unrest really, made us look internally at what we're doing as a medical school and what we can do to promote social justice, to encourage diversity, equity, and inclusion. We had a very activated, but often angry and frustrated student body, lots of requests for action, and, at all levels, from students, residents, staff, faculty, we've been working on diversity, equity, and inclusion issues. The other thing that happened in July, we opened a brand new health sciences education center, and I'm told that alumni can have a tour, a virtual tour, I think tomorrow. But it's an amazing building that's housing not only medical students, but also other health professional schools. It's getting students out of the basement, once we can actually get them away from home into a building and into this sunny, lots of window building that includes 2 floors of simulation, as well as everything else that you can expect. And we'll share this link. I'm not going to play this video, but if you wanted a sneak preview of this, that's available. What I'd really like to do is stop and turn to our students and ask them to introduce themselves and to say a little bit about them and why they chose Minnesota and how it's going in this crazy year of 2020. And I'm going to go in this order. And Timothy, I'm going to start off with you and turn it over to you.
Well, hello everyone. My name is Tim. I am a second-year medical student, originally from Robbinsdale, Minnesota. So for undergrad, I went to Duke University and studied neuroscience. And prior to applying to medical school, I did not believe that I would return to Minnesota at any point in my training, in part because of days like today in terms of weather. But I applied regardless because a lot of my family's here, and being close to home would be definitely a great benefit for me. So got an interview and went to the interview, which had its ups and downs, but I was more impressed by Revisit Day, especially by the Office of Minority Affairs and Diversity's Revisit Social that they held. And yeah, I just felt like at home, and I really enjoyed the future classmates that I met, as well as the current students that really gave me great advice as I was discerning between a couple of choices at the time. So yeah, that is my story. I am struggling through our GI and hematology block now. And yeah, just trying to make the most of this opportunity in medical school.
Great, thanks. Krithi?
Hi, everyone. My name is Krithi Prasad, and I'm a second-year medical student. I'm originally from Albuquerque, New Mexico. So, adjusting to Minnesota winters has been tough for me. But I found myself in Minnesota because my parents actually moved up to Minneapolis around the time that I graduated from Washington University in St. Louis. And I spent 2 years before medical school taking 2 gap years. And I worked at Hennepin Healthcare, actually, downtown. And what got me really interested in the University of Minnesota was actually that I met many physicians who were also professors at the U through my experience at Hennepin. And so when it came time to apply to medical school, I was excited to apply and was also really encouraged, like Tim said, by the interview experience. The U was the only school that I interviewed at that actually talked about diversity, equity, and inclusion on the interview day. And we did a short activity during my interview day, and just the questions that were asked to, for our multiple mini interviews, I was really impressed by the nuances of the questions that were asked. Yeah, I think similar to Tim, I'm struggling through GI and heme as well. And it's been tough to learn in a Zoom school environment. I think especially because we already spend a lot of time looking at computers and iPads just to study. And so it's been difficult to have all of our classes also be on the computer as well. But I'm excited to be here. I too always encouraged by my classmates, and I found great community here. So I'm lucky to be where I am.
Thank you. Haley?
Hi, everyone. My name's Haley. I'm originally from Wayzata, Minnesota. I went to school in Texas at Baylor, so I'm used to the snow. I just don't like it, But I decided to go to the University of Minnesota Medical School because, honestly, I mean, it's a great institution, very strong within medicine. I heard that it produced great doctors, and I believe that's hopefully true. But also I heard that it's super collaborative, that it's not a cutthroat environment, that students like to help each other. And as I'm a fourth year, I've definitely seen that be the case, where all of us are in together and we share resources. And so that's been such a blessing. I also chose the U because of its emphasis on global health, both local and international. I hope to do global health in the future. And so it's been great having mentors who did work abroad and have worked within Minneapolis itself, within the refugee community, and learn from them and do different projects with them. So I've been very happy with that at the university. COVID. So like I said, I'm a fourth year, so a lot of things happened. Like Dr. Rosenberg said, we were pulled from rotation in March. And obviously that was quite a shock to all of us, but I would have to say the administration did a fantastic job with quickly, with keeping us updated with the changes, with getting us involved. We all were able to submit our name to be on the COVID action panel, where students and faculty talk about next steps, and we were able to give our input into how we think changes should be made. Obviously, I was able to go back to the clinical space in July. I'm actually applying internal medicine pediatrics, med-peds. Just submitted my application yesterday, so it's official. And so I was able to go back in July to finish my pediatric rotation that had been canceled due to COVID. So it's definitely been a big change, but I think honestly the med school has done the best that they could, and everyone's been really excited to have us back. So that's also been really a warm feeling that residents and attendings are happy to have med students back.
Great. Thank you. Rakeen?
All right. Hello, everyone. I'm Rakeen. I'm a MS3. So I actually ended up going to the Duluth campus. And the reason I came to the U of M, wasn't one reason, but a multiple. So I grew up in St. Peter. I did college in St. Peter, so Gustavus. And there's no medical school in St. Peter, so, I had to move out. But really, when I had my interview, like, I knew that Duluth, like, the actual class size was really small. And when I had met with the faculty, they were just so, how can I say it? Like, not cutthroat, but almost like they really want to teach you. And it's like feeling that genuine wanting your students to succeed. I felt that not only at the Duluth campus, but here with our educators here in the Twin Cities, now that I'm doing rotations. And like, I think that was like the biggest selling point to me. I was originally going to go somewhere else, but I don't know. It just felt like something clicked when I had my interview and I was meeting with admissions. In terms of like minority health, that's definitely another thing. But like, what was it? Like initially, I don't know if you're familiar with like the Hope Clinic. It's like a free clinic that the students run in Duluth for those that are homeless, and like stuff like that. When I heard about that during my interview, I was like, oh my goodness, we can actually do stuff during our first 2 years. And like that was another selling point. But all in all, I've loved my experience so far. And we get these applications for those general scholarship applications, and like those things help us so much, like paying for like the UAssembly step 1, like study materials, some books here and there. It's like, I don't know, but all in all, I guess I'm all over the place. I'm just so excited just to be here. So
Great. Thank you. And Maureen, I'm not seeing any questions. I don't know if there's a way of opening it up for questions, but now alumni would be a good time to ask questions.
Well, while we're waiting, I can kick things off. I would love to know, in addition to financial support, what kind of support can alumni provide for students?
I would say one of the things that I've found most helpful in my medical school career is having strong mentors, and especially having people within the Twin Cities that I can reach out to, or even if you're, in a different state and you still want to have a phone call or have a Zoom to talk over your journey in medicine, how you chose your specialty, things you've been able to do. I think having mentors are extremely important. I think that's something that's, especially within this technology age, and especially with COVID, I think we're a lot more used to talking via Zoom or phone call. And so I think getting involved that way, I think how you can do that is there's a lot of student organizations for specialties. So, internal medicine, there's a med-ped specialty group, there's a cardiology specialty group, and so many surgery, just so many different specialties. And so I think reaching out to them and just saying, hey, I'm a cardiologist. I would love to, just here's my number or here's my email if anybody wants to chat about my journey or just chat about anything. I think that's something that would be really helpful to do and really easy as well. So that's something that I can think of besides financial that is also very beneficial.
Great, thank you. And the alumni relations team is willing to help coordinate all of that.
Okay, it looks like we have lots of questions coming in. I think the first one I saw is, have we improved our underrepresented minority percentage in the class in the past 5 years? And I think some alumni might be interested in hearing how we're doing that.
Sure, and I can start. Thank you, Dr. Lavallure. You played a big role in this through your many years on the admissions committee, but I would say that that underrepresented in medicine has been a major focus as we've tried to make the medical school class more diverse to better reflect the changing population of the state of Minnesota. And what historically was about 9 to 10% underrepresented in medicine, I think we're now year 7 of having the percentage be more in the 18 to 20% range. So and it's been steady for sure for the last 5 years, but I think even the last 7 years. And I think it reflects a lot of factors. We have some robust pipeline programs, including a new one that tries to recruit, the best high school students in Minnesota from broadly diverse backgrounds. Where we go to recruit has been broadened. Taking a more holistic review as part of the admissions process is also been important. And I'm glad one of the students mentioned about diversity being one of the things that's addressed now as admissions competency. So lots of potential reasons. I think we still have work to do from increasing diversity of our faculty. And I know that's been a major effort on part of the dean. So I don't know if students want to add anything to that. Great. There's some great questions here. So this is, I can take this, Lindsay, if that's okay. What's been the highlight of your medical school experience so far? Maybe we'll start with Timothy and work through the 4 students.
You may need to come back to me. I need to think for a moment.
Okay. Krithy?
Sure, I can jump in. I think the highlight for me in medical school so far, I think it's hard to even think back to before COVID because I think this experience has just been so monumental for many of us as learners. So I think the highlight for me has been seeing how students have really come together, I think, since the murder of George Floyd and have really taken up advocacy and have really started pushing not only the administration to incorporate some changes to make our institution more anti-racist and more welcoming to diverse students, but also to make sure that we're giving good care to our diverse patients as well. But it has been amazing just to be a part of a student group and largely just like a group of students who are ready to tackle these really difficult challenges in medicine. And for many of us, advocacy and serving the community and wanting to make systems level changes are the reasons why we came into medicine in the first place. So while there has been a lot of civil unrest and the circumstances are incredibly unfortunate, I think it's been amazing to see how students have really taken this opportunity to push the boundaries of what is possible in medicine.
Thanks, Haley.
I would say the highlight of my medical school experience has been, so I was able to do some research on PTSD in unaccompanied refugee and asylum-seeking minors. And through the University of Minnesota Global Pediatrics Department, they were able to give me funding to present this research in Beirut, Lebanon, September 2019. So I was able to go to a conference there and present my work, and definitely could not have done it without their financial help. But it was amazing to be able to interact with people from all over the world, to see Beirut. Obviously, it's been in the news recently, and I was kind of able to see learn about the medical side of that city before a lot of things then now happened. But that has definitely been my highlight so far.
Thanks, Rakeen.
So I guess it depends when you ask me, but like I'd say it's almost a tie. So one was when our group of students, we changed all of the paper records of the Hope Clinic into EMR, and that was just huge because you could actually like look at everything on the computer really quickly. So that was great. But I'd say more recently, it's just between all this COVID chaos and like people getting their exams rescheduled left and right. That's like passing step one. Like just coming out on the other end. I'd say that was my highlight. So.
Great. Tim?
Yes, so I would definitely echo Krithi's point about the support and mobilization of my peers. But I would also say more recently, I had my first clinical experience. So the first opportunity to apply all of my knowledge from my first year in a clinical setting. I was a bit nervous, of course, but it was a great learning experience. And yeah, I just felt so comfortable being in that environment.
Great. Thank you. So this is another one for all the students, and it's a great question, but what do you think you're learning from this time during COVID that will help you prepare for being a practicing physician in the future? And just to give the alumni some perspective, and I know you hear a lot about it in the news, but COVID has been so overwhelming, for both the medical school, but all of our hospital partners. And there's been issues with PPE. There's been issues with, just having, cancellation of elective procedures. So clinical capacity is down, yet, faculty were totally overwhelmed with COVID. I mean, it's been a really disruptive thing. And, going from in-person learning and having contact with people to virtual learning. I mean, our students have been through a lot. So I would love to hear their answers on what you're going to take away from this COVID time, for you in the future as a practicing doctor. And maybe Krithi, we'll start with you.
Sure. I can speak more to the curriculum side of things because one, that's what I'm experiencing the most right now, but also similar to Haley, I've been working on the MS2 COVID action panel to kind of help our administrators and educators figure out how we can best be adapting the curriculum during these times. And I think one of the biggest lessons is that a lot of things that I think we think are impossible or really difficult to change in how we teach medicine really are not that difficult. I think to see how quickly changes have been made because of COVID is really inspiring. I think also just in terms of accessibility of our course materials, I mean, within a week, all of our in-person lectures were turned into Zoom lectures. And while there were some hiccups along the way and still there continue to be hiccups, I think it's been very cool to see how quickly those changes have been made. So I think going forward, I want to maintain the lesson that we shouldn't be so quick to accept, how things are done, and that we should be able to challenge how things are taught and how we're learning, because change is possible.
Thanks. Haley?
Well, for one, I'm never throwing away N95 again after just one use, so that's something. No, I would say this whole thing has just really kind of enlightened me to really think about infection control. I know this is something very specific, but in September, I was able to help organize mobile clinics in southern Minnesota, and we had to think a lot about the flow of patients and how do we check patients in, and where do they wait, and how do we avoid groups of people. And I think especially taking this to our common flu season, how do we avoid further respiratory infections from being passed easily? I mean, how do we avoid, you know, a lot of patients congregating in waiting rooms? And are we going to require masks in the future for other common respiratory illnesses? I, for one, I'm a huge fan of this, honestly, personally, and probably because I have no poker face, so this really saves me in front of patients sometimes. But yeah, I think especially just taking that into account, infection control, and then also just realizing people who are vulnerable, who may have invisible disabilities that leave them more susceptible to COVID and illnesses. I think this pandemic has also brought them to light. And so just to also be mindful of people around us who on the outside may look healthy, but who are really at risk. So also to keep that in my mind as a future physician.
Great. Rakeem?
For me, I'd say just really just being more flexible and more mindful of like really what's going around me. Like, you know, like from a student perspective, you know, it's like, oh, we have these deadlines. Oh, we have to do this assignment. We have to learn this topic by this time. And, you know, it can be stressful too, but, you know, these are like very simple problems if you think about like the grand scheme of what is happening in the world. Like there are people on the front lines trying their best to, you know, take care of everyone. There are our administration is trying to complete, like Kruti had said, that going from in-person to online just like that. And, you know, it's not gonna be perfect, but they're trying so hard. And the fact that they listen to us. I know one issue later on was like we were having issues with scheduling. We had changed it up so that it would be almost like a free-for-all, and we didn't like that. That was just too stressful. But like we voiced our concern, and like immediately the next time it was fixed. Like just really being mindful that, you know, people are trying, just being willing to be vocal and like more empathetic, I guess. Say those are the biggest lessons I've learned so far.
Great. Tim?
Yes, so this ties into what Haley said in a way. But one lesson that I've learned is how to be a trusted source of information. And by that, I mean that even as a medical student, some of my peers who are not in medical school and some of my family look to me for information. And it is my responsibility to provide them with timely and information, although it is rapidly evolving, of course. So just taking that responsibility on now and kind of like working through like how I can do that, whether that's reading journal articles or whatever means it takes to be updated on literature. Yeah, it's definitely something that I've learned.
And let me just add two things that as the students sort of you know, alluded to, you know, we as administrators needed the input of students really badly, and the structure that was set up was to have COVID action panels from each year. And so that we weren't making decisions in a vacuum without student input, but there was a structure, and it was a way for us to work with students, get their input, try to fix things you know, that were broken, and anticipate you know, what future issues were going to be. The other story I'm going to tell is about PPE, because, you know, once students were out of the clinical environment, it became really challenging to get them back in. And we had to, because, you know, they needed to get rotations so they could figure out what specialty they wanted. They needed to get rotations to get the letters of reference they needed for applications. And, you know, every time we talk to our clinical partners, and we have great partners in the VA and Hennepin Health and Health Partners and Park and Fairview and Essentia and St. Luke's, PPE was always the barrier. You know, our nurses don't have PPE, or, you know, we can't afford to have, you know, learners in the environment because they're going to use up the PPE. And so we made a decision we're going to take PPE off the table, and came up with a bring your own PPE plan. And the hospitals didn't quite like that, but they said, why don't you donate PPE to the hospitals so then we can tell our nurses and pharmacists and patients that having medical students actually results in a plus in PPE for our site. And so, that's exactly what we did. And, that was actually one of the things I did, was become the PPE procurement person. It was actually really easy through the university to get PPE, and we shipped it to all our clinical sites. And all of a sudden, what was a barrier became a real plus. And I think that played a big part in getting students back in to the clinical environment. And that, I think, addresses Elsa's question about, COVID and how it's going to impact medicine. And, I think at some point we'll be able to look back, and, students will be able to tell, their peers or their children about how they lived through medical school during the time of COVID. And I think it will be, something that I hope will be unique and far in the past by the time we get out of this. So here's a question. Do you anticipate major changes to the medical school's curriculum or the educational process evolving the next 5 years? And I have my answer, but I would love for the students, as your education connoisseurs, to comment on, what would you like to see changed in medical education based on your experiences so far? And I'm going to go to Krithi first.
That's a great question. I think we all, as medical students, have dreams for how medical education could change, and how that would benefit students and be good for our mental health and all of that. I think thinking about COVID and the changes that have been made, and the urgency with which we are having to think about social determinants of health, I see that medical education will start to incorporate more topics around public health and social determinants of health and structural racism. The step one is becoming pass-fail for the class below us. And so I think with the testing scoring changes, I think that there will be a bigger opportunity for medical schools to think more critically about what do future physicians really need to learn about. And I wanted to bring this up in a previous question too, but I think COVID has taught us that much of our health is not actually determined by disease, but by the context in which our patients are living in. And so I think all of the COVID pandemic has brought that to light. I think that USMLE changing their scoring practices will provide an opportunity for medical schools to expand their curriculum in these areas. So I'm hopeful that that will happen, and I'm excited for future medical students who will hopefully get to spend less time in the nitty-gritty biochemical pathways and can learn more about how patients are situated in communities and what that means for their health.
Great, thank you. Haley?
I would say, so, we obviously made this major change, like Dr. Rosenberg was talking about having to move everything online, and that included rotations. And so this year, a lot of us fourth years were able to undertake a lot of electives online, and there were a lot of new electives. There were electives related to global health. There were electives, COVID Innovation Lab, where you could come up with your own research project or join one that was recently done or started. There was a medical education elective that, again, you could work within the medical school to research something that they were needing change on, or something of that, or another project. And so I'm really hoping that some of these online electives stick around, and especially the electives that you can kind of a make your own elective. I had mentioned before that I had in September helped organize mobile clinics, and I did that through the medical education elective, and I was able to start working on a curriculum for mobile clinics, and also work within the medical school and the other health sciences school to start talking about how do we get an interprofessional team year round to be able to do health in a mobile situation. And so I could not have done that without the medical education elective. And so I'm hoping that these electives are here to stay, or at least some of them.
Great. Rakeem?
So for me personally, I think I might be the minority with this like thought, but I really like so our current structure for our rotations is you have an online portion and then you have the in-person. So for example, for pediatrics, I'm in pediatrics right now, so I have online 2 weeks and then 2 weeks in person. I love this type of structure mainly because I'm going in, I've already taken my shelf. If there's a shelf, I already know like what do I need to know, like the bread and butter. And then when I'm there, I can put my like 100% effort in like, okay, how can I be part of the team? How I can really learn about medicine. So personally, I'd like if there was like an option of something like this in the future. True, there's less clinical time, but I feel like then the time that I do spend in the clinic, like I can put wholeheartedly towards patient care and learning rather than learning the material for the first time. But yeah, so maybe an option like that would be cool in 5 years, but I don't know. So.
Great. Tim?
So Krithi kind of eloquently put everything that I've been thinking about in terms of changes to the curriculum. But I would also add that I hope that because of the events of the past few months, that there will be more community engagement incorporated into our curriculum, because I think there is a great need, and I think the medical school should fulfill, that obligation of helping the community and training physicians to be socially responsible and engaged in the communities that they serve. So I think that hopefully will be one of the changes that we see in the next few years.
Great. And, I would add, as the science of learning has gotten more and more developed, we know what's the best strategies for, having our students learn. And it's not the lecture format. It's definitely more active learning. And I think more and more we're going to be turning to that. And that's one of the goals of the new Health Sciences Education Center. It's set up to be active learning. So students, doing some pre-work, but using the classroom to solve problems, to get questions answered. And also simulation is going to be more and more a big part of what medical school is going to be like. And then much more focus on outcomes than curriculum and process. So what are the outcomes we want our students to have when they leave medical school, and how to and to have individualized pathways that allow them to get to those outcomes. And that's a whole another topic of conversation. So why do you think, going to the next question, and thanks Elsa, applications are up so much at U of M? It's a good question, and who knows, but we're up 31% nationally at 16%. It's totally overwhelming for our processes, but we're mobilizing resources. I'd like to think that there's more of a focus on health, that's brought about by COVID, when people can watch TV and see that being in medicine can make a difference. The other thing, and I'm not sure it's affected us or not, but because of all the hardships of doing the MCAT entrance exam, we've allowed students to apply this year without having an MCAT score, because the stresses, both because of COVID and racial unrest and cancellation of exams and everything else, we wanted to make applying to medical school as easy as possible. And we're one of the only schools across the country that have done that. I don't know, students, if anyone has any other ideas of why you think applications are up.
For me, it's just, again, like what you said, my brother's an undergrad and his friends like were texting him when they heard the MCAT, the thing about the MCAT. They're like, oh my goodness, the MCAT is not a thing anymore, or whatever it may be. But
it's interesting, even though it was optional, about 95% of all applications this year have MCAT scores. So I think hopefully it sends a signal that we're trying to look more holistically at applicants. So I know we're almost out of time, but this last question I'll ask the students, what's the interview process for the students? And there are two interview processes, but I think this probably means applying for residency programs, and it may be more of a MS3, MS4 question. So Haley, maybe I'll let you take a shot at that.
Yeah, so for residency, like Dr. Rosenberg said, everything is virtual. And so it'll honestly be I'm very curious on how what that's going to be like. I'm sure a lot of Zoom, and it sounds like from programs so far that it's still going to be kind of a day long. They're just trying to figure out what to do about usually in the night before there's a resident and applicant dinner, and obviously that can't happen in person. So I think they're just trying to figure out how to have some more of that just plain resident applicant mixers. I think all of us on the applicant side are kind of wondering how they're going to wine and dine us from afar. So we'll see about that. But can't talk too much into it. I haven't had an interview yet, obviously, since applications are pushed back and they're due tomorrow, or they open tomorrow. But it sounds like they're going to try to keep it pretty similar. It'll just be virtual.
And, so tomorrow, October 21st, is the date. So most of the students, the fourth years, have sent their applications into the application service, but it gets released to residency programs tomorrow. And, the thought is residency programs are going to have a lot more applications than they've ever had before. And, without travel, it does level the playing field. So it's, it used to be a really expensive part about medical school is applying and going on interviews. And so now everyone will have virtual interviews. So I think it will be one of the interesting COVID related things. So before I turn it over to Maureen to wrap up, I want to thank Tim, Krithi, Haley, and Rakeen. We have absolutely amazing students, and you got to see some of that today. But thank you, students, in the midst of everything you're going through to take this hour and share some of your thoughts. So Maureen, I'll turn it to you.
Thank you so much, Dr. Rosenberg. And again, special thanks to our panelists, Rakeen, Krithi, Tim, and Haley, for sharing your experience and insight today. It's greatly appreciated. Again, the recording will be made available on the Alumni Celebration website. And on that website, I also linked up the video of the Health Sciences Education Center that Dr. Rosenberg referred to earlier. You can find that on the Asynchronous Activities tab of the Alumni Celebration website. And the U of M Foundation is hosting a tour of the Health Sciences Education Center, a virtual tour this Thursday. And if you're interested in that, please email me. So thank you again, Dr. Rosenberg and our student panelists. I want to thank all of our alumni for joining us, and we hope to see you on another webinar this week.